few weeks ago, the FDA approved what are called gummy bear breast implants. And a local plastic surgeon is one of the first in the U.S. to actually use these implants with his patients. In fact, he's the first here in Jacksonville and Ponte Vedra. Joining us now, Dr. Louis Obi, back in the morning show to talk more about this new FDA-approved procedure. Good to have you here.
Thank you very much, Bruce.
All right, so let's talk about the name. It's interesting because when you say gummy bear, it conjures up the image of a children's candy. Why are they called gummy bear implants?
Nutrell or Allergan coined that term many years ago. And because these are solid implants and they're sort of like a gummy bear, you can slice them in slices and the gel does not spill out. It's a solid matrix.
Okay, and we'd heard before about problems with silicone implants leaking and the saline implants. So the advantage to the patient of using the gummy bear?
The many advantages, first of all, in contrast to the traditional implants, these are shape or form stable, whereas the other implants, the gel gravitates to the bottom. So these implants will actually determine the shape of the breast, whereas the pocket in the breast determines the shape of the implant with these. And also with there's a much lower risk of rupture, and if there's a disruption of the capsule, it's a solid matrix, so there's no gel spill into the body. These are like honey, so if you cut in these, they'll spill out. And of course, in Europe, there's 95% patient approval of these. They've been using these for about 15 years in Europe. And as you mentioned, they've only been released about 2 weeks ago.
Now, I know they're a little more expensive. Is there any downside? Are there any patients who might not be eligible for this gummy bear implant?
Yeah, you have to be at least 22 years old to be eligible for these. These are very good for reconstructive patients, and they are more expensive. They do require a larger incision. And if the ladies want a round upper full fullness look, these are not the implants for them. The round implants will provide a better upper pole fullness.
So you're saying there's some cosmetic implications to which
there is, because these are anatomically shaped, so there's less fill at the top than the bottom. And so anyway, this is, but I think for the reconstructive patient and majority of the cosmetic patients, these are perhaps the best choice.
And the outcome and the patients who you've given these implants to, their reaction?
Again, in Europe, they've been used for about 15 years, and there's over 95% patient approval. With these implants, we do have about a 30% reoperation rate in the first 5 years. So this hopefully will reduce that.
Excellent. So if people want more information, what's the website they can go to?
Obi Plastic Surgery, and I'm not in Ponte Vedra, but I'm in.
Well, it's right there on South Beach Parkway.
Yeah.
So
anyway, yeah, Obi Plastic Surgery. Thank you very much.
Dr. Obi, always a pleasure. Good to have you here.
Same here. Thank you.
Cutting edge technology, and you see it here first on the morning show.